Good morning, everyone. I just wanted to rectify one thing. I'm just an undergrad. I'm not yet a doctor, but hopefully soon I will be. Today I'll be presenting on the Gender Gaps in Surgical Society Awards. So, for disclosures, there are no disclosures or any significant funding. Over the past few decades, there has been an increase in women in the medical field. According to the AAMC, there are 57% of women applicants for medical school, but also 54% of these women are enrolled in medical school. Despite this increase in numbers, there are few women that are promoted or hold leadership roles within the medical field. According to Ken et al., only 30% of these women are in the tenure track faculty part, and 39 of them hold dean position, 38% of them hold private positions, and 30% of them are presidents, and 37 hold public positions. So, what are the reasons? Over the past years, they have used the pipeline theory as a way of a passive way saying that, implying that when we increase women in entry-level positions, then that might lead to a greater presence of women in leadership roles. But actually what we have seen, that's not the case. So this is the pipeline theory. It shows the influx of women in the medical field over the years, but as time goes on, it gets decreased and decreased and decreased due to multi-factors. The gender gap in medicine is influenced by multifactorial things, and some of these things are implicit bias, stereotype threats, lack of representation and mentorship, institutional and cultural factors. These are all elements that have contributed to the gender gap in the medical field, specifically surgery. But one thing that I would like to highlight is the lack of leadership and mentorship within the medical field, especially for women. Transitioning from medical school to the practice, residency, you tend to leave behind your mentors that you have met in medical school, and now you're in this whole new community wherein you have to form your connections. You have to find people that you feel like community that can guide you through this new community, and that has been a trend wherein female tend to lack those mentorship that they need. The aim of this study was to describe and delineate gender gaps in surgical society awards. Methods and analysis that we use, this is a retrospective study looking at surgical society award recipient between 1936 and 2023, data collection from 22 surgical societies, and the award categories were trainees, achievement awards, public services, research, and first author for group work. The primary outcome was gender of award recipient and the number of awards per gender. The secondary was trend in award recipients of gender over time. Results. So out of these 22 societies, all of them that we looked at, less women receive awards, more males were given awards. But specifically, I wanted to highlight two of these societies, which is the AHPBA and the IHPBA. The AHPBA, 11 out of the awards that they give, only one were given to women since the year of 2012 to 2023. And the IHPBA, out of 18 awards that were given since 2004 to 2022, none were given to women. Why is that? Are women not eligible for those awards, or were they just not qualified enough? So, over the years, since 2006, the proportion of women who won award have increased by 0.7% when controlled for surgical societies. And the odds for women to receive an award from a surgical society increased by 3% every year since 2006. And this is just another way of viewing that graph that that I showed previously. So we might say that, okay, this is an increase, but is this really an increase compared to a male counterpart? The study do have a limitation, which is a study that spanned over 90 years, including when women just entered the medical field. So there might be a tendency for more male to receive more awards than women during the 90s compared to now, when women are starting to enter the medical field. And the lack of transparency of gender on the Surgical Society website, not including their pronouns, and no data availability on the number of individuals eligible for the awards or the number of applicants that applied for that specific award. And it's a retrospective study, which sometimes can lead to misclassification bias, which is when involves gender-neutral names. That was an issue that I faced when I was doing this, wherein gender-neutral names can, without putting in the pronouns of the individual, can be very much hard to determine what specific individual received that award, so that was a limitation. Conclusion, women are still underrepresented in leadership roles in surgery. Societies tend to award more men than women, even regardless of years of practice within the field. The number of women receiving awards have increased, but there's still more room for improvement. And I think we can work more on that. Thank you, and I can take any questions that you have.